Greetings, I'm Professor Kim Jong-un, working at the Department of Prosthodontics at Yonsei University College of Dentistry. Today we're going to talk about digital implant abutments. Recently, many are fabricating abutments using CAD/CAM method. Those with considerable experience might recall that in the past we used to use stock abutments. As of late, with advancements in fabrication techniques and designing techniques, many people use custom abutments. Scan data is used to design the prosthesis, and it is fabricated. Custom abutments are fabricated. Here is titanium abutment. You can do gold coating or anodizing to provide a more yellowish shade. This is zirconia link abutment. Zirconia is added here on the abutment. This needs to be customized to the patients. We need to determine whether aesthetics or function or intricateness is most important. Depending on the situation, we can use different abutments. The basic is that we need to use top-down method. The purpose of our treatment is to provide well-functioning implant prosthesis. In the case of anterior zone, we need to provide aesthetic results similar to that of natural teeth. What kind of prosthesis are we fabricating? This is the starting point. From there, we move on to treatment. This is referred to as top-down method or restoration-driven implantology. We determine the crown, and based on that, we design the shape of the abutment. First, let me talk about titanium abutment. Titanium abutments are known for its durability and biocompatibility. It is an excellent abutment material, and we can provide gold color as well. In the case of anterior zone, in order to get a more aesthetic result, you can use gold color. Coating or anodizing can be done. Our natural teeth has a slightly yellowish trait. If the abutment color is slightly yellowish, we can get a better shade more easily. If you look at the gingival area, if the gray color shows through, the teeth looks very dark, and aesthetics can go down significantly. If we provide gold color, even if it shows through in the gingiva, it doesn't look awkward, and we can get a more aesthetic result. When you use titanium abutment in this way, we can utilize anodizing or coating. Also, we can use zirconia abutment. What is important is that the entire thing should not be zirconia. In the past, there was such an abutment, but there were reported fractures in the neck area. As a result, we no longer use full zirconia abutments. In the connection area where implant prosthesis is connected, this has a titanium structure. This is called a link abutment. Now we move on to the abutment designing phase. This is a hybrid type abutment where it can be attached. When you want to maximize aesthetics, such as in the anterior zone, it can be used. Once crown prosthesis is complete, this kind of design can be provided. I've talked about aesthetic results. Titanium link is used. If the abutment is made in zirconia in the gingival area, you'll be able to prevent the metal ring showing. Also, you can prevent situations where metal color shows through the gingival area, and you can get a better aesthetic result. When you use basic titanium abutment, you cannot make the margin show through. It should be sub-gingival. However, in this gingival area, the metal color can still show through in some cases. Metal color can be shown through when there is alveolar bone loss around the implant. Not right after implant prosthesis delivery, but with time, these can become an issue. In the case of anterior zone, when we do abutment selectment, we need to pay a lot of attention and consider various factors. We're talking about the fabrication process. The first is oral scan. You can use oral scan or use model in a conventional way, take impression, make model, and do model scan. Once digital data is gained, you can put it in the CAD software and fabricate abutment and the crown. The final process is milling. You can utilize a CNC to make abutment in one step. If you have milling machine personally in your private clinic, you can purchase pre-milled abutment from Austin and also rod for the connection area and process it. An abutment is fabricated through scanning, designing, and milling process. Austin offers these options as mentioned. One fit abutment. This requires a CNC milling from abutment connection to the suprastructure. Milling is done in one step. As a result, you can get highly precise abutment. Also, there's pre-milled abutment. If you have equipment available, you buy a rod. The connection can be bought. The connection can be fabricated using a rod that fits the implant structure that you use. You need to choose a connection structure that is compatible with the machine that you have. This is very important. You need to buy a rod that is compatible for the pre-milled abutment and do milling. Abutment can be fabricated in-house. Third is link abutment. As for link abutment, on top of metal, zirconia milled abutment is attached on top. Austin offers different link abutments depending on size and height. You can use the most appropriate one. This is an abutment where cementation is involved. This is the crown, and these options are available from Austin. You can choose the most appropriate abutment depending on the situation. In the case of abutment for link abutment, you can make it white. But if the patient's natural teeth have a darker shade, we can vary the color of the abutment like this. These options are available, so you can use amongst the three colors. These options can be chosen. Maximum length is 18 millimeters. And I've talked about the CNC milling. From connector to the suprastructure, milling is done. When you look at SEM image or electronic microscope, there's no major defect or error in milling. You can see that the connection structure is quite stable. The biggest problem with custom abutment is that when you do not use products from the original manufacturer, there can be issues long term. If you use the products from the original manufacturer and do CNC milling, you can get precise results long term. We need to understand the characteristics of the processing involved. We can make it like this. Subconsciously, as we design, this area can become very sharp. This kind of design is not very favorable when you use milling machine. If you have milled abutment like this, the inner surface of the crown will become sharp. But that is not easy to do. If it has a sharp edge, the tip of the burr in the milling machine will not be able to access it. The crown that it goes on top of abutment will not fit properly. When we design abutment, we need to make it round in order to make the crown fit proper. That is a very important issue. Next, let me talk about pre-milled abutment. You can buy pre-milled abutment and rod like this. The connection area is processed already if you have milling machine, or if the lab that I work with has a milling machine, you need to buy rod from the original manufacturer. The connection area is already cut, so you just need to fabricate this area and complete the abutment. Link abutment can be used here. As for link abutment, library can be utilized. This is a huge benefit in designing using CAD software. You pull the data from the library, and if you design this area, through cementation process, hybrid abutment can be fabricated. As mentioned before, the superior part needs to be compatible with the milling machine that I have. We need to check that ahead. Then connection and processing can be done. Pre-milled abutment is added to the prefabricated connection area, which was processed using CNC. If you look at the overall process, you can take impression or do oral scanning. Abutment designing can be done, and you connect the pre-milled abutment with the milling machine. This process is quite important. We're going to process the area that is on top of a pre-milled area, so we need to be very precise. CAM software is used, and we need to do merging very well. We need to match the coordinates of the connection area accurately before processing in order to get the desired abutment form. Except for connection area, we fabricated the top part, and once this is done, the abutment is complete. After that, you can fabricate the crown that goes on top. As for link abutment, if you have machines such as CAD/CAM and milling machine, you can buy link abutment, and using the library in the CAD software, after you do designing, zirconia milling can be done to get the suprastructure. Once you do design of the zirconia titanium hybrid design, through zirconia milling, we can get superstructure. We can get more aesthetic results, but because you need to cement a link with zirconia, the process can be a little bit more complicated. If aesthetics is most important, you can use link abutment and zirconia superstructure. You can make a hybrid abutment. This is a very important option. We need to utilize it. As mentioned, it's used for anterior aesthetic zone. Once complete, it looks like this. It's abutment up to here, and this is the superior crown. A link abutment was utilized, and after bonding process, you can get this kind of result. If you have CEREC machine, there's scan body which is compatible. You can put it on top of link abutment and utilize it. By using these components, we can do fabrication. This is the overall process once again. Zirconia milling and cementation is done. This is referred to as tie base as well as link abutment. you need to be aware of these different names, then it will be of great help. Once complete, even in cases where the patient has very thin gingiva, because the metal color does not show through, you can get a fairly aesthetic result. It's a very essential option that's available. You need to apply it accordingly. In the anterior zone, I think you need to understand more about the characteristics of link abutment. The tooth form in the anterior zone is quite thick in the cingulum area, but towards the incisal area it becomes quite thin. If you use a cylinder-type link abutment, the prosthesis could become extremely thin here. In that case, you can utilize open type. There's more space available on the lingual side. There is an option that is an alternative to cylinder type for link abutments, and depending on tooth position, you can utilize it. Open type is used primarily in the anterior zone. If you look at the overall process fabricating link abutment, this is the conventional way. Rubber impression is taken, model is made. Indirect digitalization is this process. Through model scan body is connected and model scanning is done. This method is direct digitalization. Scan body is connected intraorally and scanning is done, and after that, we need to pull the library for link abutment. From the CAD software, we pull the scan data. Using the flat surfaces basis, library data is pulled, and once merging is done, we can pull the library here and we align the scan data. We can import link abutment library like this. What this means is that in reproducing implant position, this is basic. What we're doing is that on top of the implant, we're connecting link abutment. We can pull library with the link abutment on the implant. Because the link abutment is already connected, based on the scan body information, we can provide design for the suprastructure as well. Being able to use library on the CAD software is a major plus. We need to check whether we already have library data. On top of link abutment, we fabricate a structure made of zirconia, and after that, bonding is done. After surface treatment, bonding is done. Sintering is actually done first. After sintering, if necessary, coloring is done. I've already mentioned that there are 3 different color options. You can do coloring as necessary and then move on to cementation. Resin cement is used here. This process is most important. It affects the durability of abutment, so we need to do it very precisely. Surface treatment needs to be done properly as well. Last, I want to talk about multi-abutment. Multi-abutment is used for multiple cases rather than single implant cases. This is stock abutment rather than custom abutment. This is internal implant. But for multi-unit, external type is much more favorable. When there are multiple implants, we can do passive seating very precisely. The multi-abutment is connected to the internal type and changes the characteristics to make it like external implant. On top, cylinders can be used to finalize the prosthesis through cementation. There are cylinders that are casted as well. Utilizing these, we can add metal structure on top of the multi-unit abutment. There's angled option, be it anterior or posterior area. When we need to provide one-piece restoration for multiple implants, it can be utilized, especially in the anterior zone. There can be placement angles, so we need to use angled abutments. As mentioned, after connecting a multi-unit abutment, this becomes a scan body. There are different sizes for cylinders that are connected to multi-unit abutment. You can use the appropriate cylinder, and on top we provide prosthesis. When we place multiple implants and provide restoration, multi-unit abutments can be a very important treatment option. When you look at the overall workflow, as for multi-unit implant from placement process, we need to control the placement position. We need to take a CT and fabricate one guide before moving on to guided surgery. We do immediate loading frequently. After connecting multi-unit abutment, scan body is connected. Impression can be taken, oral scans can be taken. Also, we need to take a jaw relation because this is an edentulous area. We need to consider the vertical dimension and take a jaw relation and design prosthesis. Within the prosthesis, there is a cylinder. That's the same one. Occlusal screw is used to retain the prosthesis. This is a connection structure. This is an important option when using multiple implants. In the end, we can provide a provisional first. When designing final prosthesis, as mentioned earlier, we use cylinders used for multi-units. Different materials such as zirconia can be used for segmentation. You don't automatically get passive fit in fully edentulous cases. In order to get the passive fit, you need to take a very precise and accurate impression. This allows for passive fit, or else this can become increasingly difficult. This is a very important component. When connecting multi-unit abutments, the implant level becomes tissue level, as we provide characteristic like external implant and the component comes up to the gingival level. As mentioned, this is a straight type. There are different angles, 17 degrees, 30 degrees. This is scan body. And we need to choose the cylinder according to the position. The cylinder is connected here. Through screw, it is connected on top of multi-unit abutment. These are overall components. There are different components available depending on the gingival height, be it straight or angled. Following the situation of the gingival thickness in the area where implant is placed, we can choose the appropriate options. In this lecture, we have talked about different implant abutments. I have introduced different abutment options that we can utilize after digital impression taking. If you're interested in more specifics, please refer to offline master course. Thank you.